Hi, I'm Samantha. Welcome to the Evidence-Based Mommy. And today I'm here with Holly Strobel, who is my physical therapist. She has a doctorate in physical therapy and she specializes in women's health. And so we're here today to talk about feeding positions. What's best for you? What's best for your baby? So since Holly specializes in women's health, and a lot of that has to do with pregnancy and postpartum health and all of that.
Yes.
You see lots of young mothers, right?
Lots of young mothers, yes. From many things, neck problems, back problems, pelvic floor problems. We see it all.
Okay. And you're a young mother yourself, right?
Yes, I have 2 daughters. They are 4 and 5, so little Irish twins.
Yeah, so you've done...
I've been through it, yeah.
Right, exactly. Okay, great. So like I said, today we're going to be talking about feeding positions because there's lots of things that can go wrong that can give you those neck and shoulder problems, right?
Yeah, one of the biggest concerns with feeding positions is it's a sustained posture, and a lot of times we want to look at our babies. So we're in a very hunched over kind of neck hanging posture, and we don't take the time to give our neck range of motion and really let those muscles relax and be where they need to be. So it leads to a lot of cervical strain, which then affects you throughout the day. You know, you have a lot of neck and back pain. So always remember, you want to bring the baby to you instead of leaning to your baby when you're feeding, whether with a bottle or with breast. And this is when it's really important to be using your pillows. Can I use you?
Yes.
All right. We're going to get our baby here. What's our baby's name?
I haven't named him, but he's actually been in a video with us before, believe it or not. So, you know, he's like our little
One
model.
of the most popular feeding holds is the cradle.
Right.
So you have the baby in the arm there. And see, so you already did it. You kind of brought the baby to you. And one way to really help with that is to use your boppies or just a standard pillow to support the arms. And you want to cradle the baby's head. Now, for you and baby, it's important to maintain a neutral posture at the head for you and at the baby's head. So we don't want to look at our baby and him or her be, tilting one way or having its chin down into its chest. So it should look really neutral and comfortable.
Yeah, and that's actually harder for the baby. If you've got the baby pulled up here and, it has to have its head that's not good for the baby doll, right? It's certainly, you can't drink well like this.
Yeah.
Like, how could a baby?
Right. And don't be afraid to even use, cervical pillows that we travel with. The boppy can be even around your waist as a lumbar support or around your front as a support for the baby. And also, this is a great time. I know we all want to look at our babies and watch our babies, but once you know the baby's on and feeding well or has the bottle well, this is when you want to practice, doing chin tucks. Great posture exercise. Yeah. So you're just trying to line your ears up over your shoulders. Should be pretty gentle. Perfect. That's it right there. And just hold it for a few seconds, and then you can let it go.
Oh, that's new for me.
Yeah.
Thank you.
This is also a time to just, do ear to shoulder, real light and easy.
Feels good.
Up and down. Good. So we're giving our neck the motion that it needs, because right now we're probably sitting a lot more, not doing as much.
Yes.
And again, we always want to look at our baby because they're just so cute.
Right.
The next hold that's pretty popular is the football hold.
Okay, so that's
very similar. So yeah, baby's legs are kind of at your side.
Okay.
Yeah. Same thing. You're just going to use those pillows to bring the baby up to you. So the arm shouldn't feel like it's doing a lot of work.
Right.
And you shouldn't feel like you have to slouch to get the breast or the bottle to the baby.
Right. Perfect. So everyone's a different shape. So it just kind of depends on where your breast
This seems to work better too for women with larger breasts or with babies who have cleft palate and have a hard time latching.
Okay. And it's good for C-sections too.
C-sections too, because it keeps the weight off the abdomen. Yep.
Okay.
Another very popular position is the sideline position. Kind of hard to show here, but if you can just imagine. All right. So when we want to do the sideline feeding position, try to avoid couches, real soft recliners, in case you fall asleep. In beds with a lot of pillows behind the baby, because we don't want to fall asleep and have something happen.
Yeah. So it's okay if you fall asleep, if you're on a bed, a nice firm mattress, because that's going to happen because you're exhausted, right? But as long as you're on the right kind of surface, it's okay. So just throwing that out there.
Throwing that out there.
All right.
So again, so you have the baby sideline, and you can use pillows behind your back to keep yourself kind of up, propped up, so you don't feel like you're leaning forward on the baby.
Right.
And same thing, you can kind of have a little nursing blanket or a towel rolled up behind the baby to help support them as well. That's pretty much it for the sidelines.
So you can either be like this, or, you know, if it's like they wake up again and they want to feed again, you know, you can do it this way too. So it takes a little practice. Like the first, I've been doing this for 5 years now, so I've gotten pretty good at this, but it took probably a month or two to get comfortable with it, and that's okay. But once you learn how to feed this way, it's so much easier.
I think from a physical therapist standpoint, again, we're looking for neutral. So if you feel like, you know, your head's straining or you know, turning, build yourself up with pillows between the knees, pillows behind the back. Do what feels comfortable and feels effortless is really what you want. And
you can see, you know, again, if you happen to fall asleep this way, the baby's not near the pillow. So when you fall asleep, breastfeeding baby, the baby is naturally, you know,
gonna let go.
Yeah, that's true. And the head's going to be at breast level, and so it's going to be away from pillows, so that's going to be okay.
Yes. Another fairly new hold is either the sitting or kind of that laying back, which you can probably show a little bit if you just lean back with the baby.
Yeah.
And with this, it's important that the baby is supported underneath the buttock.
Okay.
Good. And again, your neck is nice and supported on a couch, your pillow. Perfect. This is a great hold for babies with reflux because it keeps them upright more instead of that laying down position. Or babies who have been prone to swallow or to choking. Also, women who have a large milk supply.
Because it slows down your
flow a little bit. Yeah.
So, and it's helpful. It's kind of one of those things, you know, when you're just exhausted because you've just gone through childbirth. This is a really great way, you know, for you and the baby. It requires less effort for both of you
to be laying back. Yeah, it's less energy, more efficient.
Yeah.
So at home, obviously, you'd have to use pillows. We have a thing here.
Perfect. Thank you. So here we are. And you can have the baby either like this way or a little bit sideways, especially if you've had a C-section, having the baby, you know, more across your chest this way might work better for you.
And this here, again, is where we might want to use some pillows under the arm or a low back roll, pillow under the knees if you're comfortable with that, to make the low back more comfortable. Okay.
Yeah. Thank you.
You're welcome. That's pretty much kind of my information on postural feeding.
Okay, great.
We are going to supply a link to this blog that walks you through, I think it's 4 or 5 exercises, some postural exercises that if you're starting to have pain or we're just trying to prevent that postural neck pain, that you can work through.
And if you are having issues like this, and if you're in the central Pennsylvania area, of course, Atlas Therapy is here to help. So we've got, they've got a center. Yes, there you go. We've got a center here in Altoona and then one in State College.
Yes.
So thank you so much.
You are welcome. Absolutely.